And the purpose of this slide really was to highlight the fact that our systems, all of us are continuously working on how do we improve. And I have to say, I've gotten enough gray hairs now in my life that I'm really frustrated with where quality improvement is. We have all been spending a lot of time doing quality improvement projects and programs and education and teaching, and yet we still struggle. The United States, and I'm not going to do one of these, you know, what's all wrong with the US health system, but you all see it every single day. We have safety problems, we have enormous cost, a lot of waste in the system, and I don't mean waste paper that goes in the waste paper basket, but I mean duplication of tests or missing an opportunity to intervene at the right point in time. Patients that disparities and inequities that we've all seen that have really been uncovered with COVID-19. I mean, the list goes on, and it's a little frustrating that we haven't been able to make the gains that I think we should have made by this point in time. So I think that we all need to take a fresh look and come at this work with the perspective of, we've been working for a long time to build that straight rocket. We're still dealing with systems that are creating these flawed rockets. How do we really address this in an academic and rigorous way? So let me, I do have some slides, and again, I'm going to apologize that I can't see all of you at the same time when I have the slides up, but please just shout out and stop me if there's a point that you want to spend a little bit more time on. And I don't have a lot of slides on, and I really do want to make sure that we have time at the end for discussion. The IOM Crossing the Quality Chasm is probably between that publication and the publication related to safety to air is, oh my God, I forgot the name of it, but both of them coming out around 2000, 2001, really did set off a lot of the public discussion about quality improvement. And I love this. Between the healthcare we have and the care that we could have lies not just a gap, but a chasm. If you haven't read the IOM Crossing the Quality Chasm, I haven't either, despite having worked in this field for a long time now. But Don Berwick wrote the user's manual to Crossing the Quality Chasm report, and that was published in Health Affairs, and it's really easy. It's very compact, so I would recommend reading that and studying that, because it's really condenses this entire quality chasm report to something that is pretty digestible. When people talk about quality of healthcare, all of us kind of go, oh, like, what's the framework? So many of you, I'm sure, have heard this acronym. What are the 6 elements of quality that we should be attempting to improve? Safe, timely, effective, efficient, equitable, patient-centered. And then I added the C, because I think without coordinating the healthcare, each silo that the patient touches could be very high quality, but if we don't put them all together, we won't get a good result. And I always think, I'm a pulmonary critical care physician, so I always think, you know, my job was to keep the lungs going, the kidneys going, the gut going, the brain going, the muscles going, but they all had to work in a coordinated fashion. And if you were just creating silos of perfection, so if we're ordering mammograms and radiology does it well, and primary care does it well, and you know, the scheduling does it well, but they don't all flow together nicely, the patient will end up with a bad outcome. So coordination is really important. And I want to start by talking about the concept of taking quality improvement and how do you translate that work that you're doing into scholarly products? Scholarly products being maybe it's a poster presentation or a paper or an oral presentation at a national meeting, or an application for a grant, etc. And I do want to acknowledge that there's tension here between those of us, and I'll put myself in that quality improvement bucket, and the traditional paradigm of research. And I'm sure all of you have experienced this. The traditional researcher is looking to fill a gap in generalizable knowledge. They may be testing the applicability of research in a real setting, or they want to inform future research questions or advance knowledge. It tends to be long-term horizon, very knowledge-oriented, somewhat abstract, probably more expensive than what we're used to, the resources we used to have. And negative outcomes are okay. That's, if it didn't work and you were able to study why it didn't work, that's okay. That's a contribution. When you're on the floor, when you're in the clinic and you're trying to do quality improvement, you got to fix it. You're working on something that's broken, not a gap in knowledge, but something's broken that needs to get fixed here and now. My patients are coming in and leaving without getting their mammograms ordered. Who was talking about all of my clinics consistently run a half an hour late and we can't get the staff out the door on time. These are problems that are real. They impact you right here and now. And you want positive results. You're not that interested in the theoretical construct related to why there was a failure. You want to figure out how to fix it. And these tend to be projects that are very practical in nature. They're working quick, it's action oriented, and you don't have, $1 million budget to spend on getting clinic appointments to end on time. So there is this tension. I actually think that the tension offers a lot of opportunity to learn, and it also really opens the door to great partnerships where when you can reach across that traditional aisle and partner with a researcher, there's a lot of opportunity to learn from each other, quite frankly. So I often get asked the question, and in fact, I'm often confused about how does all this lingo fit together? And people talk about quality improvement science, quality improvement research, implementation research, health services research, and more recently, and this is where I've been spending more of my time recently, is in community engaged research. So I thought I would take a shot at trying to define these different points along what I think is really a spectrum of improvement research, and then give a few tools for how to move from a quality improvement activity to more scholarly contribution. Definition of quality improvement, this comes from Paul Batalden, the combined and unceasing efforts of everyone to make changes that lead to better outcomes, better system performance, and professional development. He doesn't mention in this definition the concept of value. In other words, how do we eliminate waste or increase value? But I think all of us would include that as well. And what you'll see missing from this is it's really not intended at this level to make a contribution to generalizable knowledge. But I think as we start to think about quality improvement research, we really are thinking that we're going into the work to learn about change. Again, quality improvement, we're focusing on what's here in front of us. It's going to be fast-paced. It's a real problem. We want to learn about what makes a successful project to fix a problem that we're dealing with. But I'm going to go into that work with the goal of sharing this information. What I'll be sharing will be what I discovered through my quality improvement work. And it will probably be very context dependent. It will be, I am improving colorectal cancer screening at Dartmouth-Hitchcock clinics that are located in rural environments. It will probably be rather context specific, but I do want to study this in such a way that I can share it in a cogent fashion. I think another step along this spectrum of research is the concept of implementation research. And I want to, first of all, I should confess to all of you that I think a lot of these terms get used somewhat interchangeably, and you could all argue with me about where did you get this term, and this doesn't really fit with other lectures that I've heard. So I'll just tell you that I think there is a lot of a loose definition around these terms, but this is the framework that I have been using to help me organize my work. Implementation research is focusing on the actual implementation of that practice. How is it implemented, translated, replicated, and disseminated in the real world? Anthony, you were talking about the multiple different projects and how we tend to get all these projects that we then have great difficulty taking one of those best practices and disseminating across multiple areas. It is the bane of all of our existence when we have one clinic that does it great and there's 5 other clinics in the system, and for God's sake, we can't get the other clinics to adopt this best practice. So I think understanding how we take how do we get what works to the people who need it, and to do that faster, more efficiently, and to end up with a high quality product. So implementation research. Health services research, I put this one out in front of implementation research because in my mind, this is getting even to that bigger system approach in terms of how do we organize the finances, the systems, the workflows, the multiple people who come together to create a healthcare service. And so to me, this really starts to get into that much larger system focus. So if you took your colorectal cancer example and said, I'm going to work on how do I improve colorectal cancer screening, making sure that patients who I give the FIT cards to actually return them in the mail, and then start to think about how do we create a system that proactively identifies patients, proactively gets them their card, has a closed loop referral of being able to identify who didn't return their card, knows who needs to get a colonoscopy, is able to schedule that colonoscopy in a short period of time to get the results from the colonoscopy back, to have patients automatically entered into a recall for colonoscopy. There, we're starting to think about that big whole system that goes into creating health service outcome. And again, when we get to this level of research, we're really trying to understand on a big scale, what is that knowledge gap that exists or skill gap that exists. And we are often starting this research with a theoretical foundation and usually having to use a more sophisticated study design. And often this costs more money than doing a simple quality improvement project. And then finally, this is where I've ended up really spending most of my time over the last couple of years, and that's community engaged research. In fact, it was interesting as I was getting ready for this hour with you, is that I realized how far I've moved from my quality improvement roots. And there are many definitions of community engaged research, but I think the concept of it's an approach for conducting research that really works collaboratively with the populations, not only collaboratively to do something with, but to actually understand what are those critical questions and problems that the community wants to engage in. I think some great examples, you know, I want to improve colorectal cancer screening for the population, and you meet with a group of community people and they say, I don't care about colorectal cancer screening. Our kids are dying of overdoses in high school. That's what we care about. So if you want to help us, that's what you need to work on. So I think it's really being willing to work in collaboration and partnership to identify what is the problem, what's the best study design to address that problem, and then how to disseminate the findings. Don't work with the community, write the paper and leave, but how do I disseminate and get those solutions to come to fruition? This is very hard. Nancy's actually, Dr. Pondi's really an expert in this area. It's very hard. And it's particularly hard because funding doesn't work like this. You apply for a grant for a certain problem. And so, you know, you really need to have strong relationships in the community to get started. So this is a continuum, and I really can't give you, I can't tell you where one ends and the other starts, but I used this little table, and I actually passed along to Dr. Pondi another table that is more complete about making that differentiation between quality improvement and a research project. And Nancy, hopefully you can pass that out afterwards. But I use this little table just to help out and to sorry about that, and to explain and to think about the different approaches for these different levels of research along that spectrum. One of the things that I'll talk about a little bit is this IRB, whether an IRB is required or not. And you can see under QI that the answer here is no. And it's true. I mean, you all are doing quality improvement every single day, whether you know it or not, in your clinical settings. I will say that if you go to a project and your idea is that, oh, I'm going to do a quality improvement project, but you have a little tickle in the back of your mind, like, if this works well, and all of you, I'm sure, do, because you're working with, you're educating, you're working with trainees, and you know, every single one of you talked about, I want to do a poster or a paper or do a presentation. It is always easier to build a relationship with your IRB and to go for a letter of exemption, if that's an appropriate category for the work that you're doing, and it probably is if it's a QI project. And then you've got that letter in hand when you do go to publish. You know, this activity was exempted by our IRB board. So I would encourage you, even though it says no under QI, I would encourage you to think about working with your IRB early if you think that this is something that you'll end up publishing. Every IRBs are just different. I mean, you just got to get to know your IRB board. And I have definitely had times where I've finished the project and then went, oh, that was good enough that I should try to publish it. And then I go backwards to the IRB, and there's usually not a problem. But I think in the last couple of years, really, many of us are trying to get that IRB exemption early, if that's appropriate. So I won't talk through this other than to just let you know that I do think that the scope of what you're trying to do, the impact that you're hoping to have, whether or not it's to just actually improve what's happening right there at your clinic, or to make a contribution to, say, policy or generalizable knowledge, does help you sort out where you are along the spectrum. And why is that even important? Well, as we go to do our work, You know, I stole this actually from Dartmouth. I didn't even realize that Dartmouth was, for years, I didn't know. I knew about Squires. We're going to talk about that right now. I didn't even realize that Dartmouth was the home of that until I got here. And then I went, oh my gosh, all these years I've been thinking about Squires, and here I am right here at Dartmouth. But this mantra of our improvement work is incomplete until it is published. While that is true for all of you who are in academic and teaching positions, that's certainly not true for the whole world. And I do think that's one reason why improvement work is hard to learn from each of us, because many people are doing a lot of great improvement work, but not publishing it. I would challenge you to say that in the positions that you're in now and the positions that you will have in your future, you really do want to get your work out there. If for no other reason, you know, academic promotion, et cetera, the world needs your work. So please, as you go to do your improvement work, think right from the beginning, is this something that I can be presenting and publish as we go along? So I have a couple, I just want to look at the time. I have a couple slides. I'm not going to walk through all these. Again, I sent to Nancy, Dr. Pandey, I sent an article that walks through in detail this guide, this framework, and there's this website. I highly recommend using this website. Squire is the Standards for Quality Improvement Reporting Excellence, and this is the best cookbook anyone is going to share with you in quality improvement. It really helps you go from doing that project to writing. If you go to this website, it literally walks you through how to write a paper using these guidelines to communicate the great work that you're doing in improvement. And I'm not going to talk through all these, but I just want to show you how cookbook-like this is. It will tell you exactly what to put: title, abstract, problems, rationale. It walks right through this. Again, I'm not going to talk through this, but this is an example right off the website of how it guides you through all the different phases of a paper. And not only that, but it will, on that website, it has a much more detail and will actually give you examples of interpretation or summary or limitation. They took like some of the best paragraphs from different papers and have added those in the in this table. And so it really, it's a very, very easy to use and practical tool on how to take your process improvement project or your performance improvement project and to translate it to a paper. So let me give you a hint. Print these out and tape them to your wall. And before you start your project, walk through this guideline and just be thinking in your mind, aha, when I go to write this paper, I need to make sure that I really have a good sense of, for example, the results. What will the diagram or the table look like? If my project goes well, what will the table look like that I will be able to share my results? Think about this ahead of time. It will make it so much easier as you do your project.